Welcome back to CI Living. What if you held a clue that could help find a cure for cancer? It's possible that we may be able to help those living with cancer. All it takes is signing up for the American Cancer Society's research study. Joining with me now with more about that is Lawrence Underwood, who's the Regional Director of Health Initiatives. Lawrence, welcome.
Thank you. How are you doing?
I'm excellent, and I'm glad you're here to talk a little bit about this. Tell us a little bit about this cancer study.
Well, Cancer Prevention Study 3 is a 30-year longitudinal study that the American Cancer Society is supporting, that we're trying to make correlations between environment, lifestyle, behavior, genetics, and cancer risk. What we're doing is we're working with individuals from the community, individuals that are between the ages of 30 to 65 that have never had a cancer diagnosis and that are willing to kind of make a long-term commitment towards cancer research by filling out a survey every other year for 30 years.
Sure, that's for a long time, and the whole goal is to get that data over a longer period of time to mark the trends.
Correct.
Right?
Correct.
Okay, and so why is doing that important?
Well, yeah, there's a lot of reasons why helping us to eliminate cancer is very important. Number one being, of course, our organization is founded to eliminate the disease in our communities and actually out of our lifestyle. So throughout this study, this is actually the fourth generation of research like this. What we've been able to do is this is some of the work that we've been able to make correlations between lifestyle and also cigarette smoking and lung cancer, obesity and cancer. So this is kind of the research that will help us to develop the trend of cancer as we progress throughout our time.
All right, and as you just saw on that graphic there, it's important to note that the participants you're looking for have not been diagnosed with cancer at this point, right?
Absolutely. We're also looking for the individuals that have had a skin cancer like basal cell or squamous cell cancer. They can participate. But individuals that have had other types of diagnosis, they can participate by being champions. But we're looking for individuals that have never been diagnosed to actually enroll in the study.
And so is there anything more than they have to do than fill out this survey every other year?
Yes, there's a process. So
Okay.
what individuals do, they go online to cps3illinois.org. and they select an enrollment location in our eastern region. There's actually 5 different enrollment locations, which I'm sure will be enlisted on the screen. Actually, there's one in Champaign County, there's one in Coles County, there's one in Vermilion County, and there's also one in Effingham County. So an individual will select an enrollment location. Then from there, they will fill out a baseline survey. It's kind of like a comprehensive baseline survey. It just talks about lifestyle, environment. Has anybody else in your family been diagnosed with cancer? From there, the survey takes about 30 to 45 minutes. From there, on the appointment time that they select at one of our enrollment locations, they will come in for a 15-minute appointment where they will fill out a confidentiality form. There will be another small survey, and then there will also be a waist measurement and a blood draw. After that, every other year for 30 years, they will receive a survey in the mail, and they will just kind of fill out, more questions as it relates to, have you been diagnosed with cancer? Are you smoking? Are you being physically active? How many fruits and vegetables are you eating? Things like that. And that's that's the entire requirement.
And that's the data that you're gathering. And then what happens once all this is gathered? Are you going to do portions of the study at a time? Are there phases? And then you'll get the data on that and then see whether they correlate to other over the longer period.
Absolutely. As individuals are diagnosed with cancer, we look retroactively at that data and kind of see if there's any parallels between what individuals have experienced in their life, and that's exactly how we find out those correlations and those information over time.
And a lot of people have the American Cancer Society experience in their life.
Absolutely.
Especially with things like Relay for Life.
Absolutely.
And so now this is another opportunity to actually participate in the research itself.
That's exactly it. We've done a wonderful job in our eastern region partnering with hospitals like Carl Christie Clinic, Presence United Samaritans Hospital, Sarah Bush, just so many organizations, and we've been able to actually put on fundraising events just like the Relay for Life. We have a wonderful patient navigation services program. So what we're trying to do as we're evolving our relationships, we're trying to include the research component, and we're very happy to partner with those individuals.
And so what ways can survivors help if they can't be involved in the study?
Survivors have a wonderful part they can play, because the survivors are the ones that they're really passionate about helping us eliminate this disease. So we're looking for them to help us spread the word, spread the message. We have a position for them called champions, where they work with individuals in their communities, in their churches, in their groups, support groups, things like that. Tell other individuals about the study. We're really trying to create a buzz about this. We need to enroll about 700 to 800 people in our eastern region, so we're really looking for those survivors and other individuals that can't enroll to be able to help us to spread the message.
And as Lawrence mentioned, there's multiple opportunities to participate. There's a couple July dates here. So Tuesday, July 9th is at Carl, right here in town.
Yes.
But there's several other dates that you're seeing now on the screen in Effingham and down in Coles County as well. So lots of opportunities to get connected and be part of this study that could potentially make a difference in how we tackle cancer.
Absolutely. The thing I always say that, everybody might not be eligible to enroll, but there's something that everybody can do to help us spread this message. And I'm really excited to be able to help out with it.
Well, Lawrence, congratulations and good luck with everything going forward.
Thanks so much. I appreciate it.
We'll put this information online as well, so you can check out all the dates and the information to get signed up for the study. Just go to ciliving.tv.